This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. Welcome to the show. Happy Father's Day. Nice to have you with us for our holiday get-together here. Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. What do we talk about here on the show? Well, the clue is in the title. It's about health, specifically you and your family. We'll talk about things to help improve your overall quality of life, and we'll do that with the one and only Dr. Molly Fantasia, the PhD doctor and the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always, our number here in the studio, if you have a question for Dr. Molly, 855-839-1210, 855-839-1210. That's the number. At any time during the course of the show, if you have a question or a thought for Dr. Molly, feel free to call in at 855-839-1210. We want to say Happy Father's Day, Dr. Molly.
We want to say Happy Father's Day to all the guys out there. And, where would we be without the fathers? Where would we be without dads?
Well, this is a perfect time to tell our story.
Yes.
That you were 5, and your dad got you a chemistry set.
My father was a wonderful guy.
Most girls your age were playing with dolls.
Well, that is true. But my father happened to be a very smart guy. He was a plumber. And, he used to kid all the time with me, even later in life. And he'd say, plumbers make more than most doctors. And I used to say, come on, Dad. He'd say, nah, come on. He said, you got to be a thinking person. He said, when you have tools, you have to be a thinking guy.
And he gave you a tool to start with.
Yeah.
And my father got me a tape recorder when I was 13.
There you go.
With a microphone that had a special thing where you could bend the mic. So it was like...
So dads out there, listen to what your kids say and what they're interested in. And you guys are the proactive members of the family, you really do the job, and I send out my best and a lot of love to all the dads in my practice, and those of you who've come through our doors to ask questions. It's a wonderful thing.
And we will be talking about some things specifically related to Father's Day. We'll be doing that a little bit later on in the show. But right now, if you have a question, again, 855-839-1210, our number here for Dr. Molly here on Health Watch. Innovative Medical, and it's not just for dads, it's for moms, it's for everybody.
Youngsters.
I mean, I saw a kind of a conglomerate in the office the other day.
Yes.
It was a young guy and a young girl.
Yes.
And then there was me.
Well, now, John, we like to think of you as ageless.
Okay.
So, we are what you would consider a primary care facility. Innovative Medical Associates is a conglomerate of folks. We are a cooperative group of healthcare providers who are like-minded, but we can do anything a traditional family practice can. You need a script? We can give it to you. You need blood tests? We can get them done. You need radiology? We can give you a prescription for the radiology. So we can do anything your old-time family doctor used to do, only we believe we do it better. And the reason is, when we give out pharmaceuticals, we like to look at them, look at the side effects, and say, what can we do to help our patient solve their medical problem, maintain their quality of life, and not suffer side effects of the pharmaceuticals?
And it's a type of thing where you really believe that not too many pharmaceuticals is the good thing.
It is a good thing. I mean, you got to take what you need.
That's really the philosophy, right?
You got to take what you need, right? Yeah. You have hypertension. Just this week, we had a situation where one of our wonderful men patients had a problem with his blood pressure. I believe the doc thought it was stress-related, but nonetheless, she put him on a small dose of an ACE inhibitor. It made sense. In the meantime, we're upping his chelation to improve blood flow. And absolutely, in 3 days, he's already had a nice shift on his blood pressure. And I don't believe it was just from the outtakes, because it was the smallest dose that we could give. But it was augmenting that with the chelation therapy.
And you augment just about everything you do with the hydration, whether it's chelation or just hydration, whatever it is. But that's kind of the cornerstone, right?
Exactly.
That the hydration is what you get.
Right, with natural substances, and we're able to deliver them with the appropriate constituents to effectuate the change we're looking for and keep the quality of life.
And it's all done through IV.
Yeah, sure.
If people come into you, and you get this all the time in the initial consultation, they come in and they say, well, Dr. Molly, I mean, this hydration stuff, does it work? I mean,
Well,
you get that every time, right?
Yes, I do. And the only thing I can say is, listen, I have a great group of patients. You want to know if it works? Let's start talking to folks who are sitting in the chair. That's number one. And number two, can I give you a bunch of qualitative data to support it? Yes. And sometimes I can even give you the qualitative data to support it. We see a change in the lipids. We see a change in the blood pressures. We see a change in cancer markers. So, yeah, we can show you.
You've seen this many times. And a lot of patients, like myself, have been going there 20 years.
Oh, yeah.
So obviously, you're doing something right.
I think so. I think so, John. And it's because of the cooperation between what we do on the hydration side of the house and the wonderful physicians we have working with us.
And you do, the physicians are pretty much involved in everything
Oh
you
my
do.
God!
Yeah,
Of course,
right.
of course. Listen, I wouldn't be sitting here. I just finished up the second book. And I went to write the acknowledgments. And, man, I realized my acknowledgments could take a full page. And because I owe so many wonderful physicians for their advice and counsel over the years, and so many wonderful scientists who put together some things that I was able to really extract and put together my protocols, that I was in awe. I was in awe of it.
Was the founding medical director, was he your biggest influence?
I think he certainly influenced me because he also was a wounded healer. He himself had very, very severe diabetes, as you know.
I remember,
he came
yeah.
to me. But once he gave me his word that he would stay with me, he said if I could get him out of that wheelchair, he was going to stay with me. And I said, guess what? I'm going to get you out of that wheelchair.
And you did.
He goes, Madam, if you can, I will be your right hand. I said, okay. And I tell you, till the day he left this earth, he was my right hand.
Yeah, he was, and a really
Brilliant
innovative
guy.
and inspirational guy.
Yeah. Very, very spiritual guy.
Yeah. You've been at this 24 years?
25.
Going on to 25.
October, 25. And I might add, 25 years. And one wonderful thing about this that I believe, you can't stay in inertia. The way I tell my patients, don't stand still. That's really how I approach every condition that we have an opportunity to work with a patient to improve quality of life on. I really look at everything that comes out to the best of my ability and then discuss it with peers, discuss it with physicians who are in my groups, like the integrative group. I have a whole group clear across the country.
Right.
And figure out, okay, what can I do to improve our hydration? And I do believe that it's always in motion, it's always fluid, and I'm always looking for something that will improve the quality of life for our patients.
I know your wheels are always turning. I know that.
I work hard for that. I do.
know that.
I really do, because I find that, I love the clinical piece. I love to see patients improve.
And if a person becomes a patient,
Yes.
what can they expect as far as length of time to see initial results?
Well, I say it's not holy water,
Right.
right, John? So
Right.
if you come in with an expectation of one treatment and you're going to be fine and you're going to have the blessed spring water or whatever it is, that's not going to happen in our clinic. It is going to take a treatment protocol to work. So anywhere between 5 to 15 weeks, we start to see improvement in patients' quality of life. And again, it depends on what the patient is coming to us for. The more chronic the condition, the longer the patient has had the condition, don't you think it takes a
The
little
longer it's
longer
gonna
to
take,
get?
right.
Well, then I'm going to tell you, my patient Sandy this week, after one treatment in the regenerative medicine portion of our clinic, which we have, she felt so much better. And I called her yesterday to see how it was doing, because I said, don't have an over expectation. It takes time. She goes, No, Dr. Molly, I'm doing okay. I don't have as much pain, and I'm feeling pretty optimistic. I said that's all I can ask for.
Well, that's a good note to take a break here. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates in Marlton, New Jersey. You have a question for Dr. Molly? Good time to call. We always tell you call early because it happens just about every week. Somebody calls and we have 2 minutes left in the show and we really can't get to you. 855-839-1210 is our number, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More of today's Health Watch after these words. And we're back here on Health Watch. If you would like to contact operators who are standing by right now at Innovative Medical Associates, you want to get more information and you want to make an appointment to sit down with Dr. Molly, that's really where you get the information you need, and Dr. Molly can kind of relate it to your particular situation. You call this number, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey, and the website. Plenty of good information on that, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, our number here in the studio, 855-839-1210, 855-839-1210. Let's go to the phones. Jonathan is in Maple Shade, New Jersey. Jonathan, good morning. Welcome to Health Watch.
Hi, Jonathan.
Yes. Good morning. Always good to hear your program.
Thank you.
Thank you for calling in, sir.
I have a question about COVID aftermath. I have a friend in South America who they sequestered down there because of travel restrictions, and
Sure.
he had COVID for 19 days.
Ugh.
He's of Indian descent,
Yeah.
and he still has trouble breathing
Of
and
course.
still feels weak. And he has a house in Philadelphia here, so he hasn't been able to come back yet. But I'm hoping when he come back, maybe he can come over and see what you could do for him.
I would love to help him. And as a matter of fact, John will tell you this. I have people who are suffering from this post-COVID long hauler issue. And I'm treating there. And interestingly enough, many of these people who are coming in to see me are relatives of my present patient population. Most of my patient population, with the help of the good Lord, did not get COVID, but they had family members who succumbed to this. And I am doing a lot of work on the post-COVID. In particular, it's interesting you called today. In particular, I'm using a certain nutraceutical that has a melting point that I have had compounded that can be used by nebulizer to help these folks breathe, in addition, of course, to the good old vitamin C that John always talks about, and I love him for it, and some other things to improve the immune system. So please, Jonathan, if he gets in, please call and we'll set up an appointment. And by the way, just so people are not freaked out about it, we actually put the COVID patients in private rooms. We have a couple of private rooms, and they're able to sit there with some other folks who are post-COVID, and they're all doing well. So again, I would love to help him. Yes.
So there is a hope for improvement?
Absolutely. Absolutely. I had a young guy come in who this week, he's in his 30s, right? He's telling me, one of the hospital systems now has a post-COVID specialist. I said, what kind of clown college thing is this? What's a post-COVID specialist? Then I said to him, well, it must be a nutritional physician. He said, oh, no, it's the infectious disease guy. I said, man, they must have found out another way to bill for it. But I got to tell you, there's a lot we can do for post-COVID, if you think, including go over his oral vitamins, that kind of thing. So, yes, please have him come in and see
Jonathan,
us.
when he comes back,
Thank
feel
you.
free to have him call Dr. Molly.
Thank you so much for the call.
Appreciate the
Thank
call,
you.
Jonathan.
God.
I just want to say one thing, that Jonathan's talking about his friend post-COVID.
Yes.
But in your facility, and you mentioned it, and I always felt like, we were protected.
We were
from,
blessed
from
We were
COVID
blessed.
because of the
Look,
amount of vitamin
I
C and
think so,
the immune
but
system development.
we were blessed from God.
Yes.
It's God's
Yes.
ingredients that,
Yeah.
that helped here
Yes.
all the way around.
So before you got to that point,
yeah, thank
you
God.
were protecting us.
Thank
Yeah,
God I
okay.
tried.
Let's
Thank
talk
God.
to Eileen in Bordentown, New Jersey.
Eileen.
Eileen, good morning.
Good morning.
Yes, good morning. Hi, Dr. Molly. I
How are
really
you?
enjoy the show. My question is in reference to osteoporosis. How
Okay.
can you help someone with osteoporosis?
Well, I'm very happy to help with this particular problem. Now, we have to stimulate the osteoblast differentiation. That's the thing. We need to get the bone back to strength. That's the whole thing. So there's a few things. In the hydration therapy, I have a particular nutraceutical that we're using besides the calcium, magnesium, the vitamin D3 plus K2. There's several things. Also, I might add, it might be something where we're doing this, not just something where we're doing something where not only are we giving the patient the hydration protocol for osteoporosis, we're giving them additional nutraceuticals that they can buy at a particular, any health food store. Barbara, of course, gives them the whole list. But in addition, we're using some exercises to help them with our doctor of physical therapy who comes in. So there are several things we can do. Please call the office. I can get more specific in the office. I really can't name all the stuff that I'm using in the IV on the air. Okay?
Okay,
How's
I
that?
just have one real quick question about the vaccine. Do you feel that the vaccine is safe? I mean, should people be taking this vaccine?
You know what? Here's the thing. I am not an anti-vaxxer, so to speak. But I do think, for example, I think that we're overzealous about vaccinating folks who've been exposed to COVID. You have to wait enough time for the immune system to kick in. If it I can't tell you don't get it. I mean, the CDC will be all over me as well as the FDA. So I'm not an anti-vaxxer. But I do believe that if we keep our immune system up, we're going to have a better response both to the vaccine and also if we contract the COVID. So I hope that answered your question. And if you have any more questions, come into the office and we can talk more freely.
Okay, Eileen?
Thank you, Eileen.
Thanks a lot for the call. 855-839-1210 is the number.
That's a very loaded question, as
Yeah.
you know, John.
Yeah.
And I try to answer it the best way that I can. And I think it's important. I have patients who come to me, their children come to me, and this would be their grandchildren, that kind of thing. And they say, what do you believe in the vaccines? Well, I'm not an anti-vaxxer, but I do believe that we are overzealous. For example, with these little babies, we're giving them so many vaccines at one time. It used to be when you and I were kids, we got vaccinated, but we had a time period where it was spread out more.
Yeah.
And, that almost made good common sense.
Yes.
I don't know how it all changed, except, maybe we should look at some other reasons.
But it's okay in your mind to get a vaccine.
Right. I mean, it's okay in my mind to get a vaccine. In particular, when we travel out of the country and everything, I think, look, you were in this, everybody in the service, John. What do? You had to get vaccines to go overseas,
yes.
and it was just a mechanism of protection. The question is our immune system strong enough to withstand any exposures? And there's really the key. Strengthen your immune system.
All right, we're coming up on a break, and we do want to talk in honor of Father's Day, not only about Dr. Molly's men's health program, but, of course, ED, which is a problem, and other things that men should be looking at in honor of Father's Day, of course. And if you have a question, again, the number here in the studio, 855-839-1210, 855-839-1210. We will be discussing, as I said, Dr. Molly's men's health program and other things here on the show. And again, if you have a question, 855-839-1210. Again, we have open lines, and we'd like to get every call in that we can before we leave you at 9 o'clock, because we have to leave, so we don't want to leave you hanging. 855-839-1210 with Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates. I'm your host, John DeMasi. More of today's edition of Health Watch after these words. Welcome back to Health Watch. Operators standing by right now, as they always are when we're here on the program. at Innovative Medical Associates. The number is 856-489-0505. If you want to, give Dad a Father's Day present and you think maybe this men's health thing is something you want to look at, you know what? I would call right now and set up the appointment. The initial consultation is complimentary. 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, when you're hanging out with Dad this afternoon, if you're barbecuing or whatever you're doing, you can catch us again, the Health Watch replay, 4 till 5 this afternoon, right here on Talk Radio 1210 WPHT. Right now, though, we're live in the studio. Questions, 855-839-1210. That's the number here, 855-839-1210. And in honor of Father's Day, Dr. Molly, we figured we'd talk about your men's health program.
Well,
and
yeah.
it's more than just
ED.
ED, exactly.
I think what happens is, one of the things that I've seen over the years that I've been doing this is that most of the daughters and the wives come in, and when they're talking about men's health, they talk about men's health in a global sense, meaning all the components, all the systems, okay? But when men come in, they come in and they're myopic. They think only about the ED. And I understand that because it's a huge quality of life issue, both for them, for their partners. But it's an interesting thing because the ED can be symptomatic of many other problems. For example, when we look at men's health, we're looking at their vascular system, the cardiac. We're looking at cardiac as well as the localized area. When we look at men's health, I want to look at hormones, John. How's the testosterone level? What's the conversion? I'm looking at estrogen. Oh, do we have a caller?
Yeah,
already?
we do have a caller.
Right. Okay.
Yeah,
Okay.
we'll get back to that.
Okay.
And it's a good topic for Father's Day.
Sure.
And it's a good thing for people to really find out more about.
Okay.
But let's go back to the phones. Eric is in Philadelphia. Eric,
Hi,
good morning.
Eric.
You're
Hi,
on
Eric.
Health Watch with Dr.
Good
Molly.
morning.
Hi, Eric.
Yes. All right. Good morning. And what I have is rotary cuff tendonitis, calcium calcification in the right shoulder.
Okay.
And I have seen a doctor for it. I do
Good.
have treatment for it.
What kind of treatment, Eric?
Which is physical therapy at home and at a physical therapy place.
Okay.
For pain, naproxen, I think that's how you pronounce it.
Yeah,
as
naproxen,
needed.
that's good.
As needed. I have not done no cortisone shot. I have, as far as pictures, would be an X-ray, and then my next step is to look a little deeper, and that would be the what's that process? That's more
PRP.
invasive.
Yeah.
No, the study that you do after the X-ray. I forget what it's called.
The you're doing a CT or an MRI, right?
MRI. Yes. So that's the next step, the MRI. The doctor doesn't think that there is a torn tendonitis due to my motion and everything. But I'm just calling it to see what your help might be for that in addition.
Well, for the
something
first,
that I might need to do.
I'm very happy you called, okay? Because you know what? This is all about inflammation.
Inflammation is the key word, right?
That's
yes,
right. And
yes.
listen, Eric, you sound like a very smart guy. You ought to be on a list of anti-inflammatory natural products that God's given us. You really should. I would do a combination of the hydration, a short course of the hydration therapy with the anti-inflammatories, and I'd have one of my physicians take a look at all of the x-rays, etc., and see if there's a possibility of using platelet-rich plasma in there. And maybe some other types of a shot, not just the cortisone shot, because the cortisone is doing nothing but bringing down the inflammation, quote unquote, in the moment. But it also reduces the your immune system, and that's something that we look at because I want you to be healthy after this shoulder gets healed up. So yeah, there are a couple of things I would look at. I can also consult with an orthopedist that we use in our facility. So there's several things we can do, my friend. So call the office and make an appointment. I think you'd find it interesting, and I want to applaud you on doing the research on things and using only the naproxen and not an opiate for this pain. God bless you, sir.
Eric,
right,
thank you
very much.
Thanks for the call. Good luck with that.
Yeah,
all right?
you know what else,
Thank
John?
you
This
so
is
much.
an interesting case because we could also use something like the medical marijuana to subdue his pain as well. So
Yeah, so there's a variety of things you can do.
There
And
is.
we talked about this last week. At your facility, Innovative Medical, it's
Has
not
several,
not just the hydration.
That's right.
I mean,
Hydration's the cornerstone
Exactly.
because I can deliver those nutraceuticals.
exactly. But I mean,
But there's other things.
I'm getting physical therapy, and now you have an esthetician there. And
But-
all
I
this
believe
stuff.
I believe in looking well too.
Yeah.
I mean, most of my patients, being well from the inside out.
Yes.
That's the point. The products that the esthetician is using actually are the products that I developed with Dr.
Yes.
Glass, and I will tell you they're dynamite because they're using the same powders that I'm using in the hydration. They're unbelievable.
It's more than just hydration.
Right
We want to
on.
get that message
Okay.
across.
Great.
We were talking about ED and
Right.
Father's Day and men
Right.
and your men's health protocol.
So let's
Go
go
ahead.
back. Let's talk about the hormonal cascade for men. That, we concentrate a lot of that on just the testosterone. It's not just the testosterone. It's about making that testosterone work for that guy, keeping the levels at a great level so that the patient feels good and not put them at risk. I mean, there's a lot of talk out there about, testosterone and using testosterone. And we're talking about testosterone that is not bioidentical. Now, when I say bioidentical, I want to caution men about this. It's not natural. It isn't natural. It is man-made in the lab, meaning by a compounding pharmacist, to fit on the men's receptors, the cellular receptors. So it acts differently. And we use that in combination maybe with some other hormones. So there are many things that we can do to improve quality of life. That's one of them. I don't want to put a guy in risk. I know the big bugaboo is about testosterone and prostate cancer. We believe that's old thinking. Several of the urologists that I have spoken to think now it may be a component of the testosterone and its conversion to a bad type of testosterone. So all of these things are that we take into consideration. Again, a lot of my guys come to us with vascular problems. It's unbelievable, right? Cardiac, high cholesterol, and you can't be myopic. Yes, we can fix the ED problem, but the protocol that we use encompasses using chelation to open up the blood vessels 12% head to toe. We might want to look at the hormonal levels and increase those in a way that works, make sure the conversions are under control, and also the use of maybe a subclinical dose of some of those wonderful ED pills and not put our patient at risk of having a cardiac event. And then, of course, the acoustical wave, which you know. So there are many things we do, John.
It's interesting, and I know you wanted to talk about this today because it fits into this point of your men's health protocols. And the thing is, this happened a couple years ago. I was at some kind of an event.
I know that story.
And it's a great story because the guy says to me, he says, "Here, take these," and he gave it to me.
I know that.
He said, "Take these." He says, "You're going to be able to, perform
right.
for 3 days."
Right.
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 And I said, something said to me, this is not right. Let me take this to Dr. Molly.
Yes.
And you looked at it and you said, yeah, you can have 3 days, but that's going to be your last 3 days.
Right.
Because
it was ridiculous.
It was got stuff in there that was.
An ingredient that was a pharmaceutical ingredient. And I just had this happen again very, very recently, so it's not over. They had adulterated, I think, rhino horn or something with a particular substance that was a pharmaceutical grade at a particular dose that could be very bad if a man is got some cardiac issues and is on some cardiac drugs. So the bottom line is, read the labels carefully and just know that sometimes the labels can be misleading. So it's good to have someone research the product, which we do for our guys.
Right. And I think the message that you wanted to convey was don't take remedies
Yes, that's what I said. I said these remedies have to be very carefully looked at. Yes, there are herbal remedies out there that are great. We tell our men about that if it's safe for them. But again, you want to use something that looks at you as a whole person. This is patient-centered care. I want to see that. I want to see how you work. What's going on? What's going on with the muscle mass in your shoulders and arms, not just in the genitalia. Let's think about this and realize, we're a little more than worrying about performance in that area.
Well, you've often said that this is not just about the genitalia. This is about the entire. You said
better believe
globally. You've always used that word globally.
Because
it's the whole body.
True. It's true. You don't have proper blood flow from head to toe. You might as well forget this because sustainability will not be there. Sustainability will not be there.
If someone wants to, and this is a great gift if you want to give this to Dad, getting him into this
for the free consult, absolutely.
Men's health program. I mean, if somebody wants to get involved, simply call you and set up an appointment.
Exactly right.
And is this something that is ongoing?
It can be. It can be. Even all the fancy commercials you're seeing on TV where the doctor's smiling and it's so easy, no pills, no needles, whatever. It's all great. It's all good. I agree with that. But you can be sure you're going to need a little tune-up because if your blood flow decreases, what do you think's going to happen?
You're going to have problems.
Yeah, that's right.
Absolutely.
Let's look at it. So once we tune you up to an optimal level, don't you want to stay that way?
Absolutely.
It doesn't mean you have to go steady with me. Believe me, I don't want you to go steady with me. What I want you to do is know that you come in for your tune-ups just like you would take good care of your car.
All right, we're coming up on our final break of the morning, which means you still have time to jump in here with a question for Dr. Molly or a particular medical challenge that you want to run by her. 855-839-1210 is the number here. 855-839-1210. That's our number in the studio. And as I said, a couple minutes left of the show. You still have time to jump in with a question. 855-839-1210. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D. with Dr. Molly Fantasia. I'm your host, John DeMasi. We're coming back. More Health Watch after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical, and just because we leave you at 9 o'clock, well, they don't leave. Listen, it's Father's Day. They're working, all right? 856-489-0505. 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. Also the number during the week if you feel more comfortable calling, tomorrow or Tuesday, whatever. 856-489-0505 is the number. It's Innovative Medical Associates, Marlton, New Jersey. And remember the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show or if you want to just hear it again, which is what some people do, we have our Health Watch replay 4 until 5 this afternoon right here on Talk Radio 1210 WPHT. A couple of minutes left of the show, which means you still have time to get in here with a question at 855-839-1210, 855-839-1210. And Dr. Molly, you wanted to talk about, I know there's a lot of chronic conditions that you've been treating for and for a long time.
Oh, yes.
Lyme is one of them.
Lyme is one of them. So, I want to give folks, especially since you're outdoors right now, a little more than we were since COVID. So our Lyme protocol, of course, it does involve the use of the antibiotic, for the first treatment, but it also uses enzyme therapy, which means we're very big on the enzymatics. So for the digestive system, because we don't want things to lay in the digestive tract where these bacteria and these viruses love to hang around. And we use herbals, and of course, I'm also using the hydration therapy with many things to promote the reduction of the negative inflammation. So it is a combined program. In addition, I don't use many things orally, but I have a product, and I actually use it also for the cancer patients, which we look at as a chronic condition. And we use something called transfer factor. I also use something called lactoferrin, which I've spoken about before on the show, which is actually a protein. It's a naturally occurring proteins. And this transfer factor, the basic concept is pretty interesting. What it does, it can teach our own immune system to start recognizing these invader cells, whether they be from Lyme, whether they be from cancer, whether they be from some other things that are causing the inflammation and causing a depression in our own immune, and they enlist our own body's cells to go after these particular substances that have invaded our immune system. Now, transfer factor, lactoferrin, that I also use again in hydration therapies. I am using this because it's found in mother's milk. John, what do you think of that? Mother's milk.
Yeah.
We all know that the many people in the natural world believe that, nursing the baby is a wonderful thing because it gives the immune products from mom to baby. We have a call.
Yeah, we
right?
do.
Okay, John.
I didn't get the town, Jim. What was the town? Kittnersville, Pennsylvania.
Kittnersville, PA.
Mike, good morning. Welcome
Mike.
to Health Watch.
Thank you very much. Good morning to you guys. Long story short, I have
Yes.
two types of cancer, CLL, leukemia,
Yes.
and
Oof.
advanced prostate cancer. And my blood platelet count is low, and I just heard you mention the platelet-rich plasma. I was wondering if that's something I can use to rebuild my platelets.
Well, I'll tell you what. I wouldn't necessarily say platelet PRP because we're using your own platelets. However, I would tell you to call my office and we can talk about growth factors, platelets, and the use of those IV differently than using it in a shot per se, like in a joint or whatever, okay? I would love you to call there. Also, if you listen to just what I was talking about right now, which had to do with the transfer factors, lactoferrin and some things, I would love, I have some data to show you how this particular these particular two products have helped people increase their own natural platelets and killer cells. So, please call my office, and I can go into more in depth. You can appreciate what I'm saying. Okay, come on, call me. You're a nice guy, and I've treated these people. Well, I don't treat. I just really, I'm just the worker bee. My physicians treat, but we treat people. The clinic will treat people who have various types of chronic conditions. And, we've seen a lot of people. It's interesting that you have the leukemia piece because I'm seeing more and more men with this. And I often wonder if there's a hormonal component to this, in particular because you have the prostate cancer, too. You have an interesting case. I'm already thinking about it. So, call me, will you?
Mike,
thank you.
Good luck
Thank
with
you,
that.
Mike.
And do call Dr. Molly
God
because
bless
a
you,
lot of
Mike.
times she can talk to you in private, which
Yeah,
you can't
do.
say certain things here on the radio.
He gets it.
He understands.
Yeah, our listeners are very smart.
Exactly. Yeah. By the
Thank
way,
you.
you're the boss. That's your role there.
Oh
okay?
yeah, I am the boss, but I
so
want to make it
people
clear.
understand that,
I want to
okay?
make it clear that I am not an MD or an
Exactly.
osteopath.
Exactly.
Okay. Thank you.
855-839-1210. You're talking about transfer factors.
Yes.
Does this help the immune system?
Absolutely, that's what I'm saying. What it does is it communicates. It helps your own cells start to communicate and then look after your immune system by going after these invaders, whatever they are, whether it's cancer or Lyme or whatever. So there is, and by the way, what I really like about this is there's some evidence that goes along with this. I actually have several of the papers that have been written on this, which is how I got interested in using a particular protein, lactoferrin, with the hydration therapy. So there are things we can do for folks, whether it's cancer or whatever. Again, I'm a member of something called the Society for Integrative Oncology, which is made up of both physicians and scientists. And we believe in patient-centered care, which you get at my facility no matter what. We're always about you. But we also use evidence information for the use of natural products. I'm not talking always about double-blind studies because most natural products don't have the ability to do that. But there are some double-blind studies from Europe that we refer to, and then there's also the qualitative studies where they put maybe 100 people in this particular trial, and at the end of the trial or at the end of a certain period of time, the people who've had the cancer are doing well, functioning well. That's what we're all about. Functional medicine. I want to improve your quality of life.
Is this only for cancer patients, or can it be used for other things?
We're using it for all kinds of autoimmune diseases, including MS, and we're seeing this. And I have a certain protocol using subclinical doses of traditional meds delivered differently, but they are useful for people that have chronic neurodegenerative diseases like an MS patient. So there are many things there that can help, but I will tell you that transfer factor helps central nervous, vascular, liver, gastrointestinal, immune, lung, pancreas, and bones. So that's a pretty intensive. I was just going to say that's a good list. Because of the communication. And again, I'm doing this not just with oral, but with hydration.
And I guess you could say that your cancer protocols are, obviously your cancer care is integrative. Correct? And
we meet a patient where they are.
Exactly.
If they want to do chemo, if they've been told to do chemo, if they want to have, I'm a big believer in the surgical debulking. You know that.
Yes.
Get it out. If you can get it out, get it out. If you need chemo, you need radiation, get it. But we also can put you in touch with an integrative oncologist who is a consultant to our clinic, and there are other ways to do things. So we're here. Everyone knows my patient, Pam, who's done none of the above and still has a wonderful, God bless her, a wonderful outcome in that her tumor markers are all very low.
Looks good and follows a good
right.
diet.
Well,
and all
there
that
you
stuff.
go. She's changed lifestyle too.
That's right.
Don't ever forget, you can't work in a vacuum, John.
That's right. Well, guess what? It's about time we put the wraps on this edition of Health Watch. Don't forget, if you want to talk to the operators, they're standing by right now at Innovative Medical Associates, 856-489-0505. That's the number, 856-489-0505. Check out the website. A lot of good information on that, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And also, don't forget, we have our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, and we have Joanne and our nurses, Jess and Crystal. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. Happy Father's Day. We'll do it all over again next Sunday. Health Watch, 8 till 9. Talk Radio 1210 WPHT. You take care.